Joining me now from the offices of the Manchester Evening News, a little bit further down Deansgate than I am, is the leader of the Tory party, Mr David Cameron. Good afternoon, Mr Cameron.
Good afternoon.
Very nice to see you here. No stranger to Manchester these days. What brings you up here this time, Mr Cameron?
Well, I've been in Bury and in Salford and mostly meeting with general practitioners because we've been launching a campaign today to try and stop this imposition of polyclinics on our communities, which we believe is going to lead to the closure of many hundreds of GP surgeries around the country. We think that, of course, it's good for GPs to get together and work in larger practices in some circumstances, but imposing them from above is just another top-down attack on the NHS, and we want to keep our GPs local because I think it's a very important part of our health service.
You may very well say that. Alan Johnson, the Health Secretary, has said today that you are misleading the public making those statements. He insists GP services are not going to be cut.
Well, I've been listening to GPs who've been telling me how under threat they feel from the government's plans. And when it comes to who do you believe, Alan Johnson, the Health Secretary, or local general practitioners in Bury, I'd go with the local general practitioners.
Do you think, though, that polyclinics themselves are a bad idea? Are they not a good idea for patients, a one-stop shop? They can see social workers, nurses, physiotherapists all under the same roof.
I think there may be circumstances where GPs coming together and providing more services is a good thing. Indeed, the GP surgery I was in Bury, they were doing just that. They were expanding their premises and offering more services. But they were very worried about a top-down government plan for a polyclinic to be shoved in next door because they said, you know, that is going to undermine all the investment we're putting in and it could lead to the closure of GP surgeries. So, yes, we need reform to the health service, but what we don't need is another top-down, government-driven fad that is going to undermine one of the strongest things of our health service, which is the general practitioner. The family doctor service is the envy of the world, and I think the government is mad to be undermining it in this way.
I don't think anybody will disagree with you in that. In fact, in a speech this morning, I believe you described what you wanted as a more decentralised, more patient-centred, less bureaucratic system. But people with memories slightly longer than mine will remember a health service under the Tory party that was, well, centralised, not patient-centred, extremely bureaucratic. Is the health service safe in Tory hands, Mr Cameron?
It is absolutely safe in our hands, and I think, you know, people who've witnessed the last 10 years from Labour have seen attack after attack on the health service. I've just come from Salford, where their maternity unit is closing, and people throughout the northwest have seen accident and emergency units being threatened with closure, maternity units threatened with closure. We've also had so many top-down reorganisations of the health service, primary care trust, primary care groups, strategic health authorities. They've changed the labelling so many times. It's been hugely distracting. It's wasted a huge amount of money. And instead of these top-down government-driven changes, what we need is to put our trust in the professionals and allow particularly the general practitioners to choose the healthcare the patient needs and to reform the health service in that way. I think that would make a big difference.
Fair enough. I'm going to move on because I know you don't have a great deal of time, and in our coverage of the upcoming local elections, one issue has come to the fore more than any other, and it's the upcoming and potential congestion charge for Greater Manchester. You've had some things to say about that recently. You've described it as conscription, the congestion charge, and the TIF bid itself.
Well, that's right. What we've said is that we think that the money should be made available to local councils for improvements in terms of buses and cycle paths and other transport improvements, but it shouldn't be tied to congestion charging. If communities want to go ahead with congestion charging, then that is their decision. I'm a localist. I believe that the right solutions for Manchester aren't always written in London. But if communities don't want to go ahead with congestion charging, they should be able to access that money. I think what people feel is that the government is sort of blackmailing communities, saying, look, this money's only available if you go for congestion charging. We would take that condition off and make that money available for the schemes that people want to see in Greater Manchester.
Just very quickly then, before you go, I want some clarification on this. You said, with a Conservative government, we will give the £200 million directly to local authorities. Is that individual local authorities, or is that £200 million spread across the whole country? Because, frankly, that really wouldn't go very far.
Well, this is a particular fund called the Transport Improvement Fund, which is the £200 million made available, but really at the moment only on the basis that councils go ahead with congestion charging. We're simply saying that money would be available under a Conservative government, but you wouldn't have to introduce congestion charging schemes. So that's £200 million, as you say. You know, that is not an enormous amount of money, but it would be available without councils having to go ahead with congestion charging. I think that is actually a very sensible move. Let's trust councils to take the decisions rather than try and write the script in Whitehall.
But Friends of the Earth have said that congestion charging is inevitable. If Manchester doesn't get the investment it needs by applying for the TIF bid, we will end up with a congestion charge, and we won't have had the £1.2 billion that we are promised if we win the TIF bid for the investment in public transport that we so desperately need up here.
Well, I don't think it is inevitable. I think different communities have got to work out the answers that they want. Look, some people might think congestion charging in Manchester is a very good idea. It just happens that there are many councils and Conservative-run councils in Greater Manchester that don't want to see this charging go ahead, but would like the money in order to provide the bus schemes, the cycle lane schemes and other schemes to get the traffic moving. And I think that, it seems odd to me making the money a condition of introducing congestion charging. Surely if congestion charging is such a good idea, it should pay for itself.
Mr Cameron, there's much more I'd like to ask you, but I know you have a busy schedule. We'll have to leave it there. So for now, thank you very much indeed for your time.